one of the real issues with endometriosis is it's such a spectrum of how it affects people. And so some people will have endometriosis and maybe don't even know that. They have very mild or no symptoms, whereas other people can have a small amount and then have really severe symptoms. And I think, Shaheen, for me, that's one of the difficulties we have when we campaign, is because we don't want to scare people who might have what we'll call very mild disease or might not even have symptoms, but equally we need to get support for people who do have really difficult symptoms. That's something you must come across all the time.
Yeah. Oh, yeah. Well, I can tell you that today I had a clinic this morning, and in that clinic I saw both of these scenarios that you just mentioned. Someone with very severe endometriosis that has no pain whatsoever, and someone who had superficial endometriosis, and with excision of the disease, the pain went away completely. And that's why we don't treat the disease, we treat the person, So what we do with endometriosis depends on how that has affected that person. There are exceptions, though. There are situations in which our hands are forced. So, for example, if endometriosis is affecting the ureters and compressing the ureters, if it's caused obstruction of the bowel, if there is any suggestion that there may be cancerous cells, or we can't be sure there aren't, these are the situations that we have to do something about it. But other than that, it's the treatment of the person, not the disease, not the scan, not the MRI.
It's interesting, Shaheen, you just talked about superficial endometriosis, and that's a phrase that goes down really badly with patients, because in medical terms, superficial means on the surface, literally measured, and whereas in common use, it sort of means that people are themselves superficial. And we quite often get calls, people going, my doctor says I was superficial about it. So I'm just going to flag that one. It needs explaining from a medical perspective. Anyway, those are the main myths that we get. Thank you, Shaheen.
Thank you.
Thank you both. Just one last question then, if possible.